Assalamualaikum. Today, my teammate Harini, Haziq and me, Nisa, would like to present about an ethical issue with genetic testing in pediatrics. First, I would like to summarize the issues that we choose. In 1983, before the efficacy of screening testing and relative benefit and risk of newborn scanning for CF would exist, the AAP Task Force on Neonatal Screening called against the implementation of state system. The AAP suggests that new scanning testing for newborn baby will implement in a careful craft way that make it easy to determine the risks and benefits of scanning. The only two states that need informed consent for the scanning of newborn are Wyoming and Maryland. 13 other states mandate that before testing, parents be told about newborn scanning. Most parents will be continue to support scanning when they are adequately informed that the risk, benefit according to the AAP. The key admiration of university scanning is the argument that the duty of the society to uphold child while subset parents' progress to approach this basic medical intervention. Carrier scanning. A significant concern raised by carrying scanning program is the possibility for individual and the community misunderstanding of the carrier state. 30. The APA does not support the board use of carrier testing or scanning in child or adolescent. In some circumstances, carrier will be in defense through newborn scanning program. For example, newborn scanning for sickle cell disease will indefine intent who are carrying. Finally, it's remains to be determined whether newborn scanning result can be used effectively year later when the person is make a productive decision. Newborn scanning testing should be considered with the equipment parents' education, including inform that implication of genetic related person. Next, predictive testing for late onset disorder. Physiology impact of false positive result when the scanning for crystal fibrosis. Parents' knowledge of neonatal scanning and responsible to the false positive crystal fibrosis testing. Parental response to repeat the testing on infants with the false positive result in a newborn scanning program. 4 years follow-up of psychology reaction to false positive scanning testing for congenital hypothyroidism. Early diagnosis for crystal fibrosis through neonatal scanning prevents several malnutrition and improve long-term growth. A survey to elevate parents considered as public policy for neonatal scanning. Scanning could seriously damage your health. 20 years outcome analysis of scanning genetic scanning program for thyroid and beta thalassemia disease carried in high school. Efficacy of a target genetic scanning program for adolescents. Finally, the genetic service. The Human Genome Project will factually the products and the genetic testing and their results implementation into clinical practice. For this specialized, the number of the genetic concentration and the genetically indicates to as some primary responsible for handling this technology. As a result, the understanding of genetic and the advantage of the drawback of genetic testing will need to be easier by primary care practitioners. Now we move on to define the genetic technologies. This presentation should be outlined the general social and ethical concern surrounding genetics. It should also take into account the role of children in the family and in the society. New platforms have arisen in recent years to resolve situations when the target research failed to deliver a diagnosis. The amount of data produced in the testing result in a high degree of sensitivity for the identification of causing variants, but at the cost of the secondary of unnecessary result which must also be controlled. That's all for me. Thank you so much.
Okay, so we go to the positive impact of genetic tests. So for the first point is a sense of release from uncertainty. That means the test result can provide a sense of relief from uncertainty and help people make informed decisions about managing their healthcare. The second point is a greater understanding of your health and your cancer risk. After that, opportunity to help educate other family members about the potential risk means knowing that a particular mutation is absent can help people ease anxiety about their own health and that of their children. Next point is we get deep knowledge about your cancer risk. It can make you know in deep knowledge about your cancer risk, an opportunity to help educate other family member about potential risk. Last but not least is information to help make informed medical and lifestyle decision. Okay, next we go to the negative impact of genetic tests. For the first point is result in some case may return inconclusive or uncertain. In some case, a test result might not give any useful information. This type of result is called uninformative, indeterminate, inconclusive, or ambiguous. Uninformative test results sometimes occur because everyone has common natural variation in their DNA called polymorphism that do not affect health. The second point is negative impact on family and personal relationship. Cancer has a major effect on marriage and other long-term partnership. After a cancer diagnosis, both individuals may experience sadness, anxiety, anger, hopeless. Next, result may trigger emotion. Finding out that a gene mutation is absent can offer a deep of relief. Next point is testing may increase anxiety and stress for some individuals. So for the last point is testing does not eliminate a person's risk for cancer. Thank you.
Okay, up next is how to tackle the negative impacts of this. So, in order to refine the current genetic testing among in the pediatrics, the acclaimed newborn screening should be reviewed and re-evaluated periodically to permit the modification of the program and to eliminate the ineffective components of the particular program. So the introduction of newborn screening tests should be conducted through carefully monitored research protocols. So where the current American Academy of Pediatrics, based on the article, does not support the broad use of carrier testing or screening in children or adolescents. Although this additional research still needs to be conducted on carrier screening in children in pediatric, the risk and benefits of carrier screening in the pediatric population should be evaluated and carefully monitored. Clinical trials before it is offered in a broad-term scale. So, moreover, the carrier screening for pregnant adolescents or for some adolescents considering pregnancy may be appropriate where it aids them to make considerate conclusions about their future, where they get to decide whether should they have a baby in the future or will it harm their health of their children in the future, and so on. So the genetic screening and testing may not be well understood since parents are persistent of misunderstanding and of their child's risk. So thus the pediatricians need to provide the parents about the limits of genetic knowledge and treatment capabilities of potential harm that may be done containing genetic information, including the possibilities of psychological harm, stigmatization, discrimination, medical condition, disability, and potential treatments, and lastly services for children with genetic conditions. So pediatricians can also be assisted with managing many of these kind of complex issues, where they can collaborate with genetic counselors, and also parental care providers as well. And next is where else for cost, it is in many cases usually health insurance plans will cover the cost of genetic testing. Most private insurers cover genetic testing for inherited mutations under the Patient Protection and under the Patient Protection and Affordable Care Act (ACA). So, genetic constellation and BRCA testing for women with specific personal or family cancer history should be covered with no payment based on this scheme. And next is genetic testing also enables individuals to be informed about their health status and have opportunity to have early diagnosis and treatments for their disease. However, undergoing genetic testing and receiving the results may also cause stress and anxiety. So thus, a therapist can help you examine source of your stress in life and begin working with address possibility causes to anticipate anxiety. And next is potential medications also can help. Firstly, beta blockers and can work as well as an occasional treatment for stress. You might consider this kind of controls. Furthermore, benzodiazepines and sedatives then also promote relaxation and calm feeling. So, whereas they can be addictive, so this is only recommended for a very short term. And you might use them to help manage serious anxiety symptoms as you begin therapy. And finally, as usual, friends and families, they always can offer their support by listening or providing positive distractions like taking a walk or cooking a meal together and so on. Okay, so as a deduction, genetic testing has potential benefits whether the results are positive or negative and for a gene mutation. So the test results can provide sense of relief from uncertainty and help people make informed decisions and about managing their health care. And it also helps people understand better their cancer risk and make medical decisions about cancer screening and its prevention. And testing for negative may provide some sort of relief for the relatives who test negative for a mutation that runs in their family, hereditary, and so on. So, however, there are limitations for genetic testing. Well, genetic testing is not for everyone, and not everyone is a candidate for genetic testing. The testing can be expensive, and sometimes it may also not be covered by insurance as well. However, the financial aid and low-cost opinions may be available, and it does not always provide an answer about the cost that causes the cancer in the family, in the particular family. So the influence that each genetic variant exerts on a person's disease risk may be tiny, but by distilling all of this person's genetic risk of disease, polygenic scores pack powerful risk predictions into a single number. So, this is exactly why the expansion of educational opportunities in human genetics for medical students, residents, and practicing physicians is also necessary for the future, where in consequence the Human Genome Project will foster the development of rapid introduction of genetic testing into clinical trial practice. As a result, primary care physicians will need to expand their knowledge of genetics and the beliefs of risk of genetic testing. So it's a very broad term. We still yet to discover many things and learn new things about genetic testing. So next is reference, and that's all. Thank you.